Well, good afternoon, Praveen. Tell us your name and the type of career that you have chosen to pursue.
Well, I'm sorry, the question. I'm sorry. You're breaking up.
I'm sorry, your name and your profession, the profession you
Oh,
have
okay.
chosen to pursue.
Yeah, my name is Praveen Malhotra. I'm an interventional radiologist, which means basically means a radiologist who does procedures using imaging.
I see. Well, I would assume that takes a lot of schooling. Can you tell us about the educational track that you had to follow?
Well, we do. I did my education. I was brought up in Burma. I spent 14 years of my, and I did my middle school there. High school, I came and did it in India. Then you do a couple of years of pre-med courses. In those days, they had shorter. They concentrated totally on medical subjects, not on subjects like geography or history, or we didn't do this thing. Uh, we didn't branch off, but just on medicine. Then we did about 4.5 years of medical school, and 6 months of sorry, 1 year of internship, and then you're ready to go into any specialization that you want. So I did my internship there. I did a year of surgery there. I wanted to go into surgery. Then I decided to come over to the United States. I thought the training here was, I would have more options here. So I came here, did a year of internship, came to Cincinnati. First, that was where the Jewish hospital. And then I did a year of surgery in Medical College of Pennsylvania. I moved there, and during that process, when I used to go to radiology to discuss cases with them, I saw them performing some interventional radiology procedures. It was an emerging specialty, and that fascinated me because you could do certain procedures with very minimal intervention. And so at that time, I decided to go into radiology. So I spent 3 years of diagnostic radiology, 1 year of a fellowship in interventional radiology in Temple University. Then I moved to University of Pittsburgh as an assistant professor. Then I realized that I really didn't like teaching as much as I thought I did. I felt my specialty was emerging. I needed to spend more time learning because I was, just doing the procedures, learning. So I moved into a practice in Ohio that was looking for somebody who would provide, expand the practice and start doing interventional radiology. So I moved to Lima, Ohio, and started my practice there.
Wow. So when you, just to be clear, when you started school and even as you completed your degree at college and then did your internship, it was after that that you changed kind of course a little bit. Did you see that surgical training and those sorts of things were a waste of time to you? Did you lose time by
No, no,
shifting
no.
direction at any point?
I think that in some ways, if you look at it, yes, I did lose 2 years. But during that time, I was exposed to surgery, the experience of surgery. Of course, I was still a resident, but I was exposed to surgery. So it didn't, I think it helped me in the process. When I did interventional radiology, because you do I don't know if you know anything about interventional radiology, we use imaging to do procedures like angiograms, placing stents, angioplasties, biopsies, and we put tubes, and we do a whole bunch of things which are minimally invasive. So I think that was a surgical experience. I think that really helped, even though I lost 2 years. So, but I didn't think it was losing 2 years. I just thought it was.
No, I think that's a great point. I think that your previous experience layered into your ability to be good at what you've chosen to pursue.
I became a little
Um,
better at it. Yeah.
a lot of students really go into college thinking that they know what they want to do, and I think you might be a good example of how really college is a good place to find out if you really are in the right go heading in the right direction or using that experience to
Once
your
you get to medicine, you spend several years rotating to several specialties. That's when you learn when I went into medical school, I thought I'd become a pediatrician, which is
okay.
non-surgical. And then once I started seeing it, you change your mind. So I always tell students, get into medical school, don't make up your mind in advance what you're going to become, because keep an open mind, because you'll change your thought process once you see all that's going on. Something is going to excite you, just like it happened with me.
Yeah, that's great advice because even as you were talking about radiology, I'm thinking in my mind of the vast array of applications of that profession. I don't know if you know, but I work at an animal facility, and we have radiologists that are working in the field with animals. And I could see even in your area of expertise, the variety of applications. Can you talk about that at all? I really don't know a lot about it.
About radiology, yeah, in radiology you have, you used to have the basic X-rays that they did,
Yes.
X-rays, chest X-rays, if you break an arm. Then they came along with ultrasound, and so, it all happened strangely at the time that we were in training. So it is sort of interesting. Ultrasound came along, and then CT came along, then MRI came along. And once those procedures came along, then especially after CT and ultrasound, we realized that we could, not me, but our peers realized that they could use the imaging to do the procedures. And so, that's where it became more exciting for people, at least for me, it was very exciting that I could use, you know, uh, whatever knowledge I have with imaging and whatever knowledge I had a little bit in surgery to be able to do these things. Now, obviously, my peers who were there who were much more smart who thought of all these things. I was just one of the followers, but I'm very grateful to them for all that they found.
Well, you are highly educated and very respected in your field. Can you tell us, though, some people just don't have the desire or maybe the ability to continue into all of the higher levels of the medical field. Can you talk about the different professions that are available in this field that require varying levels of education? I know you can go with some experience straight into a radiology department, say at a hospital, without years and years of education. Can you just give us an example of how many
So,
options there are?
yeah, if you're a physician, you just have to go through medical school. I mean, basic medical school, everybody goes through. Then they go through a year of internship, and then that's when they have to decide what they want to do. And during the internship period and during the medical education, they rotate through the hospital. They see all the specialties, they're exposed to all the specialties. And people normally get excited by certain aspects. There's basic is family practice, which is just, I mean, when I say basic, I still think it's one of the most important specialties, because that's where the patient is initially examined and then passed on to the other specialties. So if we don't have a family practice, a lot of people put down family practitioners. I think they're the most important, cog in a medical field. But they're the ones who examine the patients, and then they decide, okay, this needs to go to a surgeon, it needs to go to a GI specialist, it needs to go, need some X-rays, radiology, etc. And all. So they're very important. Then there's the internal medicine, which means a little bit more specialized. They basically get specialized into, like, they may, a little bit higher, a little bit more experience, by saying that they also normally depend upon a family practice to send them and say, okay, this is a little bit more complicated case. I'm going to send it to you to evaluate it, and then you go ahead and see that. Now, the internal medicine, between the internal medicine and family practitioner, then they, start referring patients to a cardiologist, Is that the question you're asking me? Am I on the
Go
right?
ahead. This is fascinating. Please go ahead. Yes, it's perfect.
Yeah. A GI, or you go to um a ENT specialist, an ophthalmologist, or or they may say, okay, he needs to see a cardiac surgeon because he's got some mitral valve issues. So that's where it goes up. Now, obviously, there are certain specialties which are a little bit more difficult and a little longer. Like, internal medicine, I think is 2 years. Family practice is 2 years. I think internal medicine, maybe 3 years. Radiology has become 4 years. Then if you want to specialize into my field, then it takes another 2 years. If you do into cardiac surgery, boy, then you have to do 3 or 4 years of surgery and then do a couple of years of cardiac specialty. Same thing with gastroenterology. Gastroenterology is the medical field of the GI tract, all the stomach, the colon, etc. And all. The gastrointestinal surgery is when a surgeon does perform those. So they are specialized in that areas too. So everything is getting very specialized, which is in a way good because you're getting more experienced people dealing with those problems, those
Yeah.
issues.
My question was a little bit different, but I appreciate that answer. It was very helpful. I was thinking also about the people that work in conjunction with, say, a highly specialized radiologist or someone at a physician level. There are also radiology techs who
Yes,
are taking the images, or the sonographers who are doing the image work that don't require nearly the amount of education. Of course, there would also be nursing staff and that sort of thing that all work in this area that don't require as much schooling because they obviously don't have um, nearly the
yes,
necessary skills involved.
yeah, they may not. You're right. They don't have that many years of education, but they're also very, very important. I've been very fortunate that I feel that if I did not have a good nurse or a good tech, I wouldn't be such as good an interventional radiologist as I was, because they are all like all supporting. They're there to support me, to help me,
Yes.
and they make me perfect. So
Mhm.
yes, even though their training, I think a radiology tech training is like about 2 years. Uh,
Maybe.
yeah, 2 years. I'm really not sure. I'm just uh, and then you have nurses. They have nurses. They have nurse practitioners. They are different level of nursing care also, and also nursing who go into surgery. They have some training in surgery, radiology. They go into internal medicine, cardiac surgery. Their nurses help in surgery. So yeah, it's there's a whole lot of option depending on what you want to do. It's I think medicine is a very exciting field, especially nowadays, because
Oh
there's
my
so much
goodness.
you know technology there that helps you. Did I answer your question?
Yes. Yes, you did. In fact, I was thinking of maybe a young person who is so tired of school, but they really want to get into medicine. Perhaps they could get into a tech type position rather easily or quickly and really find out what type of medicine they enjoy the most. And I'm sure there are many nursing programs now that are encouraging those people that have great interests to pursue further education and hone those skills and knowledge levels so that they can perform at a higher level.
Right.
Um, what kind of advice would you give someone? You've given already great advice about going to medical school and leaving your mind open. Um, what makes a student a good medical student? Like, who is that? What do they have to be good at doing in order to be good at medical school?
I basically the two things I think I happen to agree. Number one, you have to have interest in that subject, and the number two is you have to work hard. Intelligence only goes so far, and if you don't work hard, you know I found that I've had great teachers. That is because this, and not only me, all of the people who work with me, that they found us working hard. So they were more motivated to teach us more. You want, they have to be willing to learn. I know school is a good time to also have fun. We had fun too, but we also, when it came time to study, we studied hard. You want to be willing to learn, and you just have to work hard. There's no way out around it. But of
Yes,
course, you have to
for
be
sure.
interested in that subject. If you're not, I wouldn't go into it.
All right. So here's the question that I have to ask. Can you go into the medical field if you're afraid of the sight of blood?
I'll give you a story.
Yes, please.
My son, my middle son, uh, when I was doing my practice, I took him. He was sort of interested, so I took him to watch my interventional procedure. So we were standing there outside, with the glass there because they're not allowed in the room. And I did the procedure, and the blood spurted out, and he fainted.
Oh, no.
And at that time, he said, "Dad, I don't think I can become a surgeon." Well, he's become an ENT surgeon.
Wow.
So you'll get over it. I mean, people, initially when you see blood, everybody is scared. It's okay to be scared about blood because it's a scary thing. But you can overcome it. My son did. I always joke to him about that, but
That's a great story. I thought you were going to say he went into radiology where you're not really dealing with, I don't know, maybe in some ways you are, but that's interesting. Praveen, you've been a delight. It's so fun to talk to you. If someone should see this video and
Mhm.
think that they would love to communicate with you about the direction of their future or their career, would you be willing to take the time to chat
Sure,
with them online through our website?
it'll be my pleasure.
We
If I can
appreciate
excite
that.
anybody to go into medicine, it'll be it'll be good for me too.
Oh, we need good medical people,
Yeah,
no matter what.
just to let you know, my grandfather was a doctor, my father was a doctor, I'm a doctor, my son is a doctor. So, we are grooming one of our grandkids to become a doctor.
Yeah,
Not
the
for,
pressure is on. The pressure is on.
I'm just kidding.
Well, thank you so much for your time. It was delightful, as I said, and I will talk to you again soon at Rotary.
Okay, thank you.
Thank you. Bye bye.
Bye bye.